Hello, my name is Danny Quaranto, acupuncture physician at the Alternative Medicine Family Care Center, the most comprehensive alternative medicine facility on the Treasure Coast, treating people's problems, all types of problems. What we're going to talk about today is the natural allergy elimination technique, and I'm very glad to have Jennifer here today with me. She's graciously agreed to act as our test model, and what we're going to do is test Jennifer with some different substances to see if she might have an allergy to those things. Now, what is a natural allergy elimination technique? It's exactly what it says. Natural means that there are no exogenous substances coming from the outside. Allergy is an interesting word. Allergy is more than just the itchy eyes and the runny nose. You could have aches and pains from allergies. You could have mental or emotional problems from allergies. You could have internal organic problems happening from allergies. You could have any kind of symptom from allergies. Allergies can kill you. What else could they do? They could do anything. So elimination part of it really means that what we do is we don't just get rid of the symptoms that people have. We actually eliminate the allergy to those things. And how do I know that? Because we've had many people over the years that have come down with anaphylactic reactions to substances that if they came in contact with those substances, they were going to die or go to the hospital. And we've seen over and over through the years that people eliminate the allergy to this substance and they can come in contact with it, they can eat it, there's not a problem with it. And we don't use any scratch tests. We don't use any shots here for clearing away allergies. We use a form of applied kinesiology, which is almost the same as a scratch test without the scratching, to find out what somebody might be allergic to. So we've been treating people for 22 years with allergies, and over the course of that 22 years, we've treated people, at least in the beginning, with just trying to treat them with the symptoms, getting rid of the itchy eyes and the runny nose. This system of treating the allergies, the natural allergy elimination technique, we've been doing for about 10 years, and it actually does just that. It gets rid of the allergies. So we've seen that over and over. Some examples of things that people might be allergic to, just so you can get a sense of the scope of what allergies can cause. I recall having a 7-week-old baby allergic to mom's milk. Imagine that. It doesn't get any more basic than that. So here's this little baby allergic to mom's milk. We treated that baby one time, cleared the allergy to mom's milk. That one treatment just changed that whole kid's life, because he was looking at a lifetime of ending up being on medications and having to deal with the different allergy symptoms that would be caused. What we like to do, another person that I'm thinking about actually was scheduled to get a pacemaker because he had a very irregular heartbeat, and what we found with this person was that he was allergic to calcium. Well, if you think about some of the things that calcium does in the body, you know, calcium, one of the things that it does is it's partially responsible for the regulation of the heartbeat and naturally manufacturing bone and transmission of nerve impulses and relaxation of muscle tissue and the coagulation of blood. I mean, calcium is a big player in the body. So if you were allergic to something as basic as calcium, what kind of symptoms could you possibly have? Just about anything. Something like sugar. Many times people are allergic to sugar. Well, sugar is, you know, glucose, fuel for your brain. Your brain uses about 60% of the glucose in your body to use for energy. So if your brain was not getting the nutrition that it needed, what kind of symptoms could you possibly have? You could have any kind of symptom. So these are the types of things that we're looking at when we're talking about allergies, not just the itchy eyes and the runny nose. And if you have to keep on taking something all the time in order to fix the reason that you're having those symptoms, that's not really touching the underlying reason why you have that symptom. And if you have to stay away from something for the rest of your life, that's not really fixing why you have the problem either. So what we like to do is to first identify the allergens, and then we start to clear away those allergies. And what I like to do is to show you how we do that. And what we have here are these different vials that have all kinds of different substances in them, and very minute doses of those substances. And so what we do is we have Jennifer hold on to something. Actually, what I would want to do is test Jennifer first. Could I test that, please? Thank you. And what I'm going to do is to find where Jennifer has a little tension area there. When I mean tension, it means it's tight there. And then what I'm going to do is try and find out if she's okay to be tested, and that means she is okay to be tested. And then what I'm going to do is I'm going to have her hold on to this vial here. Now she's fine, so that means she's okay with that. Now that happens to be vitamin C. Now what I'm going to test her with here, let me try that, make that one strong. Actually, she's okay with that one. I think we might have cleared that allergy for you at one point. And I'm going to ask Jennifer to hold on to this vial here and keep that strong. And it just kind of blows out. There's no strength there at all. And that's what we're talking about with allergies. We're talking about an incompatibility. This is an incompatibility. This doesn't mean that she gets too much of it or not enough of it. It means that she's incompatible with it. And you could be incompatible with all kinds of substances. So what I'd like to offer is a gift, and the gift is the opportunity for you to come and have a free, we'd like you to come down and just have an allergy test free of charge, won't cost you anything, so that you can actually feel what Jennifer is feeling when I do the test on the arm. So you can see that I'm not pushing harder. It doesn't make any sense for me to just try and make people's arms go down. I'm going to test you, and you'll feel whether your arm stays strong or it goes weak. And if it goes weak, that means that you're not okay with whatever it is that you're holding on to. And it could be things that you come in contact with every single day.